Hello and welcome to Health Talk. I'm Dr. Manny. Since the anti-government revolt began in Bahrain earlier this year, reports of violent force against protesters and blocked access to hospitals have flooded the media. Joining me now is Dr. Nabil Al-Ansari, president of the Bahrain Medical Society, who was working inside the Salmaniya Medical Complex in the capital city of Bahrain. Doctor, welcome to the program.
Thank you, Dr. Manny.
I want to take you back to February of this year when the big revolt began to occur in the capital city of Bahrain. You were inside the big medical center, the big medical complex there. What was going on?
The health system in Bahrain is one of the, I wouldn't say the best, but it is a good health system where it provides care for everybody and it's a free care system. Everything was going well. There were protests in Bahrain and people asking for better conditions of living and better housing and all of that, and everybody is pro that. Unfortunately, the protests turned a little bit more violent. What happened that the protesters were based actually at the Pearl roundabout, or what we call the GCC roundabout initially. When the government recognized that there was violence now involved in the protesting, it kind of tried to put an end to that. And what happened is that the protesters, they moved their command center to Salmaniya Medical Complex.
All right, so let me, because I want to explain a little bit to everybody. As this revolt was going on, again, people were asking, demanding different things, but in reality, the medical center became sort of the ground zero, if you will, for a lot of the things that were happening.
It did.
How was it possible for a hospital to become ground zero where the protesters were sort of executing the direction of where the things were to go inside a hospital? Who let them do that?
You have to realize that protesters were from different groups of the people of Bahrain. There were engineers, there were lawyers, there were doctors, there were nurses. In one statement, or it was video tube actually, it's on YouTube, but one of their leaders of the protesters clearly stated that we are moving to the hospital, to the Salmaniya Medical Complex, because we know that government will not come in here after us, because the Geneva Convention states that no security forces should be coming into the hospital, and it is their statement, it's not mine. And
but now, were patients hurt in this process?
Well, for 4 weeks, the hospital was occupied by the protesters.
So there was no clinical services being rendered there?
Minimal. I wouldn't say no, I would say minimal. I will tell you statistics that we see about 1,000 patients per day in our emergency room. The numbers went down to about 150, from 1,000 to 150. So it just makes you think, where did the other 850 go to?
Right.
So people were denied access to care. One way, they were openly told not to come to the hospital. Those who have appointments, especially oncology patients and dialysis patients, were denied care.
So patients with cancer and dialysis?
And they were dying at home, and I'm a witness of some people who died actually. On the other hand, the ambulance services, the EMTs, was controlled by the protesters at the Pearl roundabout. And no ambulance service was available for the citizens who were not protesting, who were sitting at home trying to figure out what was going on for 4 weeks. And you can imagine how many people suffered from that.
To me, a hospital is a sacred ground for healing.
Yeah.
Okay? And you know it as a doctor, and you're the president of the Medical Society. You know what we feel. There should be no other business other than healthcare. So why are we at this point? Why have there been so many reports, so many false statements?
I don't know how the media played it. I have a quick question, or a question for everybody. Where was the media for those 4 weeks when the protesters were occupying the hospital? It is on YouTube. They have taken these YouTubes, not me or anybody else. They have shown the whole world that they are occupying the hospital. Media did not say anything about that. But for 4 weeks, people were suffering, and I went on public TV in Bahrain stating after 4 weeks that enough is enough. We need the government to come in. People are dying at home. They are not having access.
Where do you see the future of Bahrain going nowadays?
I think we'll be fine, little by little. But I just have to clarify something, that nobody is above the law. If a doctor made a mistake, then he should be questioned. Why did he do this?
Absolutely.
Nobody's above the law, because everybody's saying why the government is targeting doctors. Well, it's not that.
Right.
Whoever did something wrong will be questioned anywhere in the world.
Right.
Future will be bright. I mean, we are going back, we're going to talk, we're going to vent, and I think we'll get back to where we were and even better. But it will take some time.
All right. Well, you know, my thoughts and prayers are with the people of Bahrain, and I thank you so much for coming and sharing the story. And as again, you know, we will continue to follow these events in the Middle East, because to me, you know, healthcare is very important. And you know, when you're a doctor and you're a nurse, you know, we're all brothers and sisters, and we have to make sure that, you know, healthcare is protected around the world. Thank you so much.
Thank you, sir.
And if you have any health topics you want to talk to me about, you can email me here at Fox at drmanny@foxnews.com. Until next time, I'm Dr. Manny.